we're going to do a quick review of care of the postpartum C-section patient. So in the OR, what are some considerations? The woman should be laying on her back, possibly with a wedge under her right hip or with the table slightly tilted to prevent compression of the inferior vena cava. A Foley catheter will either have been placed before or will be placed in the OR. And she might be experiencing some anxiety related to the procedure, so you just want to answer any questions she has and provide support. I read this in our textbook that C-section babies are considered at risk until evidence of stability exists after birth. And her partner is allowed in the operating room. They'll be at the front of the bed, just by the head of the bed, to provide support and comfort. So immediate post-op and postpartum needs. So you're going to assess for recovery of the effects of anesthesia. You're going to assess postpartum needs and the degree of pain. So what does that look like for interventions? We're going to maintain a patent airway, position the patient to prevent aspiration. So, have the head of the bed elevated. You're going to do vitals every 15 minutes for the first few hours or until she is stable. You want to assess the incisional dressing, the fundus, and the lochia. So for the dressing, you want to look for signs of infection. You want to make sure the fundus is contracted and firm. And you want to assess the lochia for heavy or hemorrhagic bleeding. You're going to assess the lungs. You're going to monitor her IV intake and the Foley output. Typically, oxytocin will be added to the first liter of fluids just to make sure that that uterus stays nice and contracted. And then we're going to have typical post-op things like coughing, deep breathing, leg exercises. We're going to be administering pain medication. And the pain medication will be IV until bowel sounds are heard. So psychologic care. We want to make sure the woman knows that she's a new mother first and a surgical patient second. This helps the woman perceive that she has the same needs as other new moms. Women who undergo C-sections are slower to bond and to breastfeed, so this is a consideration. They may also be experiencing depression and anger if this wasn't their intended birthing plan. If they had prepared for a vaginal delivery and then that turned C-section, they might be coping with having to lose their idea of what the birthing experience was going to be. And we want to remember that taking hold is going to happen on day 3, not day 2. So pain at the incision site and intestinal gas pain. So along with pain medication, there's a few things we can do specific to each type of pain. For incisional pain, we can teach them about splinting the incision with a pillow when they move or cough. We can also teach them relaxation techniques, music, breathing, keeping the room dark, trying to rest. For gas pain, we want to get them up and walking as soon as possible. We don't want to introduce foods or drinks that are gas forming. We don't want them to drink from straws that can introduce air. And lying on the left side helps to expel gas. For their diet, they're going to be NPO until bowel sounds are present or until they're stable. And once bowel sounds are present, you can change their pain medication to be oral. And we're going to advance them to liquids first. See how they do with liquids. And then if they're tolerating liquids well, you'll advance them to solids. We want to allow adequate rest. The family might be there. Everyone's really excited. She just had a baby. They want to spend time with her. They want to spend time with the baby. But we need to make sure we give mom time to recover from this surgery. And this safety note was in our book. It says that the woman may become drowsy from sedation of the medications she's taking and may fall asleep while holding the baby. So you just want to make sure someone else is in the room with her and don't just leave her by herself holding the baby. And discharge will usually occur on the 3rd postpartum day. So we talked about these complications a few times in class, things you're going to look for after the C-section, like warning signs, red flags. So 2 consecutive temperature readings of 100.4 degrees Fahrenheit or more. Urinary symptoms like dysuria, urgency, or cloudy urine. You want to assess the lochia. And you want to assess the incision for signs of infection like redness, swelling, bruising, discharge, wound separation. And if she experiences severe increasing abdominal pain, this is also a warning sign that there was a complication. So these are just a few pictures I found. Top left is just a depiction of a C-section. The top right, that's how the patient's going to be draped for the surgery. So you can see that she really can't see anything and doesn't know what's going on down there. And then this middle one on the bottom, that's what it looks like when the surgeon's cutting through all the layers. They like hold the skin open and then he cuts through the uterus. And there's the baby. And then this is just some patient education regarding drying the baby and exercises at home. I thought those were cute. I hope you guys learned something.